This is Dr. Malik, and I'm very excited because I'm going to be demonstrating the right protocol for doing Gouri for face, neck and hands. Towards the mid of the marionette line. So if this was the marionette line, this is the rough mid, and that vector is directed towards that. So if you look at the vectors, it kind of covers the whole of the mid and the lower face. In certain scenarios, you can also go with a third vector depending on the client's needs and the facial contours. As long as the face is marked now, we would look at the forehead. We take the midpoint on the forehead. After taking the midpoint, I go to the lateral element of the eyebrow and the hairline. And anywhere in between there, avoiding the blood vessels, I make my entry point. And that entry point would go towards that midpoint. That would be for the forehead. The most important part to avoid any complications and bruising is to not inject the proximal 2 centimeters of the vector. For example, if I was to inject in any of these vectors, I will stop injecting when I reach this cross. So I start injecting from the end point, coming out in a retrograde fashion, but I would stop here. And there is no product injected in this area. This area is the area which is more prone to bleeding because of the entry needle. Put into the Gouri product. Similarly for the other syringe, .2 mils again, and as it's a particle-free product, it homogeneously mixes with everything with just a gentle shake, and everything is mixed together. So now these both syringes are ready to be injected. So the first step is to get the opening needle, pinch the entry point area, make the patient aware there's going to be a sharp scratch, and introduce under the full depth of the skin. As you can see, I've not introduced the full needle. I've only used the tip of the opening needle, and I've come out. There's a little bit of a tiny bleed showing us where the entry point is, and after that we introduce our cannula. Cannula should just glide through without yanking or without trying too hard. And I can feel the tip of it is almost reached here. Once you have reached the furthest point, you can always push the skin over the cannula like that. That actually introduces the cannula further. Now, putting the dosages towards myself, I start slowly injecting and I start coming out. As I'm coming out, I can feel the tip of the cannula. And I stop here. I do not inject in the last 2 centimeters. Then I take the cannula out, change my vector towards the nasal flare, and I again insert. Again, pushing the skin over the cannula tip, I can feel it here, and I again start injecting. And as you can see, patient is completely comfortable. I'm slowly injecting, coming out, and I can feel the tip. And I do not inject the last 1 to 2 centimeters of the vector. Bit of pressure. There's hardly any bleed, but I still like to put some pressure on. Now coming to the forehead, entry point is here, avoiding any visible blood vessels. I pinch a couple of times and introduce the cannula. Again, the cannula never crosses further than that. I take my product, introduce it, and it just glides through effortlessly if you're in the right plane. And then you start injecting and come out slowly as you inject. On the forehead, you can see the product causing a little bit of a localized edema. As you can see, I've injected in this region without injecting in the proximal 2 centimeter of the vector. There's a bit of a swelling. This swelling will go away in the next couple of hours as the product will spread itself and it does not stay in that region. Okay, now we'll do the other side. Now we're going to be injecting on the left side of the face. Again, pinching the entry point, make a little area to insert the cannula. Cannula just goes in and smoothly slides through and glides to the end here. I can push a bit of the skin on top of the cannula to go a bit deeper. And once I'm there, I start injecting and slowly coming out. Again, the key is not to inject in the proximal 2 centimeter of the vector. So I stop injecting here and I take the cannula out, change my direction and insert towards the mid of the marionette vector. Again, pushing the skin above, I start injecting and it's very smooth gliding action coming out. Again, not injecting the last part of the vector, and we are done with this angle. Now I'm going to be doing for the forehead. Again, pinching it a couple of times, making an entry point, and then introducing with the cannula. And again, it just glides through without much effort. I start injecting in a retrograde manner and I come out. And done. After the procedure, you can apply arnica gel on the entry points. Arnica cream, it helps with bruising and swelling. So you take a little bit of that, apply it on the entry point areas. Now we are going to mark the neck area for Gouri injections. So for Gouri, we mark the mid of the chin all the way down, straight in the middle of the neck to the sternal notch. If we take the midpoint of this line, which would be somewhere around here, as you can see, this would be our central vector. At the level of the sternocleidomastoid muscle, we have the entry points. The entry points will have one vector going towards the mid of the chin and one vector towards the sternal notch, making a diamond-shaped area of marking. From this entry point, one vector goes up here, one vector goes to the midpoint, one vector towards the sternal notch. And this is how we divide the doses of Gouri around the neck area. While approaching the neck area, I like to infiltrate a bleb of lidocaine at the entry point. For that reason, I just go with a very fine, small needle and I inject just enough to make a little raised bleb, as you can see. What that does is makes it easier for me to introduce the cannula. After making the bleb, I use the opening needle and I just pierce through the skin. Again, there hasn't got to be too much deep in the skin. Once that's done, the cannula can be introduced. And as you can see, there's a little bit more effort when you're approaching the neck area, but it's introduced very, very comfortably and easily. And as you're coming out, you're injecting. And don't inject beyond the proximal 1 to 2 centimeter. Then changing the direction, going towards the sternal notch. I can see the tip and I slowly inject as I come out. Similarly, I change my direction towards the mid of the chin. There's a bit of resistance. As long as your depth is fine, it should be okay. I'm just gliding through and I can feel that it's gone towards the tip of the chin, and I slowly inject as I come out, avoiding to inject again in the last couple of centimeters of the vector. Now we'll apply the same on the other side. So lidocaine injection at the entry point, causing a bleb to be formed. Once the bleb is formed, I can see the raised skin. I use my opening needle. And as you can see, the patient is completely comfortable. I've got the entry point now. Because it's a fine cannula, sometimes the entry points are very, very fine to look at. But as you can see, it's gliding through towards the mid vector. I start injecting and come out. Then I change my direction towards the chin. I start injecting, come out, and then I change the direction towards the sternal notch. So sometimes you can ask the patient to move their face to the side. It just helps. And I can feel the tip. And it's gone in. I'm starting to inject and done the job. There's a minimal bleeding, minimal swelling, and it should glide through as easily as that. Okay, perfect.
I felt really comfortable, really relaxed. I understood exactly what was happening throughout each part of the process. It was pain-free. I can see instant results. I can see instant tightening on my cheekbones. I can see an instant glow as well.